Hey everybody, and welcome to another amazing episode of We Live in Color. I'm your host, Deaunte Damper. Now, before we begin this wonderful episode, I need you to like, share, and subscribe to Converge Media, where you can learn more about Back to Basic, The Day with Trey, clapback culture, and more. Go to whereweconverge.com to learn why Black media matters. You heard me say something about Trey Holiday and Back to Basic and Basa Gordon, right? Those are my sisters. And this is Women's History Month. And I just want to take the time to just uplift my sisters. Thank you for supporting me. Thank you for always being in my corner. And it's just something about Black women who lead, which actually leads me into our next guest. She is a pillar in our community, and I should have had her here seasons ago, but here we are. Reverend Dr. Renee McCoy.
That'd be me.
That'd be me. How are you doing?
I'm great. I'm great. I'm blessed, highly favored. I'm alive. I'm great.
You know, I talk so much, and I use this word like community compass and how to navigate through this community. And I definitely feel like when I look at my compass, your face is right there, especially with leading a lot of the efforts that I started to do the work in. Especially when it came to HIV, and even in the space of the church. And I really always wanted to know how Reverend Doctor started her journey. And you're from Seattle?
No, I'm from Detroit.
Oh, excuse me.
Detroit. Watch it.
I'm sorry.
I'm from Detroit. We got more Black folks in Detroit. I'm
Okay.
from the Black place.
Okay.
Yeah.
That's Motown.
Yeah. Well, that'll work. That'll work. Well, you know, I've been doing this work for more than 50 years. But you know, Deontay, I grew up in Detroit. I grew up in a time when we didn't even call it gay. You know, I grew up in the era of bulldaggers, and you know, that was who we were. I grew up in the absence of people writing about HIV, writing about being gay. I grew up when you know, we didn't use the word queer, we didn't use the word lesbian, we didn't use any of that. You know, I grew up before I came out during the time of Christopher Street, you know, even before that. And
What is Christopher Street?
you just asking that so you can talk about it, right?
No,
Not that you don't know.
I don't know.
Christopher Street is the revolutionary uprising that started all of this. You know, there was a bunch of gay folks in New York City who just got tired one night. Got tired of being abused and treated poorly because they were gay, you know, because they were lesbians and homosexuals. And but I grew up in a time when being gay was called, you know, gay men were sissies and gay women were bulldaggers.
And how did you adapt to that within community?
Well, I think that that for me, you know, I grew up in the Catholic Church, not really knowing what sexuality meant, but knowing that I was different. And I grew up in a time when being different, all I knew was I was the wrong difference, and I didn't know how to be that, you know. There were gay clubs. There were actually more gay clubs when I grew up than there are now. You know?
Really?
But they were clandestine. They were considered, you know, it was a place where the wrong people went. You know, I grew up at a time when gay bars were being raided all over the country, where gay men and gay women and lesbians were were being abused openly, and it was nothing for the police to come through and raid a bar. It was,
Did you ever go through any situations
You
of
know
abuse?
what? I think that I came out, you know, in the early '70s, pretty much in the middle of the '70s, and we all knew what we knew. We knew what we shouldn't do. We knew what was gonna. We knew that we were going to be that in Detroit. We were dealing with both racism and homophobia, and so there were, it was a question of knowing your place. And I just, I think I became an activist because I got tired of it. I got tired of, I came out during the civil rights movement where the focus was on racial injustices and not sexual orientation. And so, our struggle was against racism, and realized that even in the face of racism, that people can come and harass you and oppress you because of who you love. But there was no pride. Christopher Street started a movement that pushed us all towards gay pride, and there was no sense of pride. So I began this work as a way of being proud of who I was. I think that my faith had a lot to do with that. As a Christian, I was always raised to stand up for your truth. And the greatest truth that I could stand up for that was the truth of who I was. And being raised, that thing about tell your truth and your truth will set you free. That truth was one of the most liberating things for me. So if you can't hurt my feelings by calling me black, because that's who I am. But I also realized that I had to reach a place in life where you can't hurt my feelings by calling me a lesbian, because that's who I am. And if that's who I am, then my faith says that I live the best who I am. I live the best black, the best woman, the best lesbian. And I also grew up, in a time where I saw, we see people dying from HIV now, but I grew up where my peers were dying from drugs, and they were dying from violence, and they were dying from just brokenness. And I think that for me, I felt God could do better, and God had done better.
Yeah.
And so it was about running and telling that.
And you've done an amazing job running and telling it here. So we're going to talk more about your journey to Seattle, running and telling that, and your dynamic work with HIV. I was very moved by what you were saying, and how you were able to continue to move. Like, what was happening in Detroit was like a cornerstone of kind of assisting you with your lift on how you choose to advocate and protect and build community. But how'd that bring you to Seattle?
I came to Seattle because of a woman.
Really? You moved because of a woman?
I moved because of a woman. I was in Detroit. I lived in New York for a while, or in New York for about 10 years. And my present wife, my wife,
Okay.
and I had a relationship. I was in New York. She was in Seattle.
Mm-hmm.
That didn't work. And 30 years later, or 25 years later, we reconnected, and I moved to Seattle because that long distance thing didn't work,
Mm.
But yeah, that's how I got here. There's no,
No,
you
no
know,
big thing.
there's no big thing. I came because, you know, love brought me here.
Let me ask you a question.
Sure.
So, 70s, 80s, because I mean, I'm having a hard time now. So, how was it dating in like the 70s and 80s?
You know, it was big fun.
Oh, so okay, so
It was
okay.
big fun. It was big fun because one of the things that happens with people who are uh, who feel that they're at the bottom,
Mm-hmm.
they also feel that they have nothing to lose, and so we worked, we partied hard, and we lived hard, and we worked hard. What I missed probably most in well, I don't see, but it's that the thing about being a part of an oppressed group is all we had was each other. And so there was no women over here, men over here, trans over here, you know. Everybody was there for everybody. And we had to be family to each other. And that was an amazing experience. So that was what coming out was for me, was you had to be family, because families threw folks out. Families disowned you if they found out. Neighborhoods disowned you. The other thing about growing up in Detroit was because racism was so strong back then, we couldn't live anywhere. And so everybody lived in a neighborhood. If you were gay, you were straight, you were everybody. You know, there was only so many places that we could live, and so we lived in everywhere. But we really took care of each other because no one else was taking care of us.
And I love that because I think that working together and being around each other and supporting, no matter however you identified or what it looked like, we still needed to be there for each other. And be together you were, because we had a pandemic on the way, and that pandemic was HIV.
We didn't know that, though.
But when it did get there, can you talk to me a little bit about what did that look like in our community? I mean, I read about it.
It was horrible. What it looked like was, one day there was this, we were, hanging out in the bars and in the clubs, and the next day we were dying. And the next day we were dying in very real ways. When HIV hit in 1981, that's when we first really took notice of it. People were dying right away. Men were dying in 9 months. Women were dying within 6 months. And it was. I was in New York City, and it hit the Black community really, really bad. It hit the gay community really, really bad. And we didn't take it. We didn't take it serious, but all of a sudden we realized that it was serious because people were dying. And it was a horrible death. You had folks with capital skin cancer, or cancer that you could see, or swollen lymph glands. You could walk down the streets in Harlem, and you would see a lot of the guys who were, men and women, who were using drugs with swollen lymph nodes in the park. But what we realized was that for the first time, the world really did not care about who we were. And if we didn't care for each other, we were not going to make it. And what also happened was that women realized that no one was going to take care of our brothers if we didn't do it. And so we had to step up, and we had to be there in a very real way. In a very real way meant that we had to go and see about folks in a very real way. If people like the people that we lift up today as the heroes of the gay community were on the front lines. Folks like Audre Lorde, Cheryl Clark, Joe Beam, Marlon Riggs, Craig Harris, all of the people, James Tinney, all of the people that we read about now were on the front line. The institutions that had kept Black folks alive, the church, turned its back on us, and the church turned, just kicked folks out. And so I came into the church through MCC, which started in the late '60s as the gay church, So I got involved at that point, and people needed to know that God still loved them. I remember the very first man that I met with HIV in the end of 1981. We had started a little church in Harlem called Harlem Metropolitan Community Church, and when it first hit, it was just white boys, and so we said, if you're not sleeping with a white boy, don't worry about it. And but in 6 months, it was a whole new page. And I went to see him. Someone in my church said, my friend is in the hospital with this gay disease, and you had to put on a robe and you had to put on masks, and they had him in a room that had three glass doors, and he wanted to know if he could be right with God. And that was what was so hard, because the medical community wasn't really concerned about black gay men. At that time when HIV hit, 25% of the people with this disease were black. We were only 12% of the population at that time, and there was nothing. And so a group of us had started an organization called National Coalitions for Black, Lesbians, and Gays, and we were just doing the social justice thing. When HIV hit, that was another dimension of activism that had to happen. And so we pulled together again and challenged the systems that were, so that we could get help for black MSMs who were dealing with HIV as well, and women, and women.
And
Nobody
women,
was dealing with women.
Well, and that's another thing that I kind of wanted to ask you. With like we seen it on towards the late 2000s, the early 2000s. There started to be more commercials and outreach towards women late in the midnight hour. But back then, what was it like to get the resources for women?
It was no more. No better than it is today, really. It was hard for women, but women, certainly black women today, are 15 times more likely to die from HIV than white women, and black women who are living with HIV. So it has not gotten any better, but advances have changed. But it's also important that if we're going to talk about women and lesbians and black women, it's important to understand that although HIV created some systems and support systems, what we have is this absence of support systems for black lesbians today. We don't have, even here in Seattle, there is no network, there are no systems that are taking place. What we're dealing with is the lack of community. When we think of community, we always think black men, or we think, gay men, but we don't talk about lesbians or black lesbians, certainly. And as there are, we're the ones who live to be the old age, So there are many black lesbians now who, in the absence of community, are dealing with the same kind of situations that older women are dealing with, and having to sort of go back into the closet in their old age in order to get that kind of support. What is needed is an organized effort to provide that kind of support for black lesbians and to build those kinds of networks. What's really, really, really important is that we somehow establish an intergenerational network where we take care of each other in a very real way. If we're going to talk about community, what does community look like?
Mm-hmm.
Who's cutting my grass? I'm old now.
Yes, ma'am.
Who's going to come over and cut my grass? You know, I got to rely on the white boy around the corner to check on me. But where's my black gay brother who, black women were there
When the tough got tough.
when the tough got tough. So who's taking care of our older black lesbians? Who's watching out? Who do we call on?
Mm-hmm.
So if we really want to talk about what's going on, it's important to talk about what's going on with older black lesbians.
Yes, ma'am.
Today.
And I think that what I love so much about you is that you don't you don't dance around anything. You keep it all the way tough, and your legacy continues to live on through here in Seattle. And we're going to talk about that and the work that you are still doing to get community members access to wellness. A lot of our community folks go through a lot of burnout. They'll do the work for a second, and then something happens where it's just like, oh, I'm done fighting the fight. I am done. But what I love about you is your willpower, that you are not only reaching out to young folks, but you're also reaching out to elders. And you don't dance around anything, but you know what I mean? It's like we have to get active. And what I love with organizing with you is that, you look and see who's not in the room and say, it's great to have y'all in the room, but we need all of our people. It's not about ego. It is about everyone.
That's right.
And it kind of comes back from even sitting here listening to your story and thinking about what the D embedded in you and what New York, how y'all work together. You brought that here, and I've appreciated working with you. And one of the things that I've loved is the work that you've done around World AIDS Day and Black HIV Day. Why are those days so important?
Because I can't forget, I miss my friends. I miss growing old with people, I'm mad about it. I had a good time. And there's a whole bunch of people that need to be here to grow old with and drink bourbon on the beach with. And they're not here. And I'm mad about it. And we cannot, we cannot let any more people die like that. But I miss my friends. I miss my friends. And I want to be, I got some ego in this. I want to stay powerful in the world. And I'm only as powerful as the power I can empower. If you're not powerful, I'm not powerful. If my presence in your life doesn't make me stronger, then I'm doing it wrong. And so I want to get all the strength and the energy I can, from it. My one of my mantras is you can either be pitiful or powerful. You can't be both. And I am bored with being pitiful. I tried that, we all tried that. But powerful is so much more fun. And so it's, I got some ego. I want to have a good time. I enjoy meeting folks. I enjoy meeting you. I enjoy, I need the energy that you put out. I need the energy, and I need to get rid of the energy that I have, So for me, it's about being life-giving. I got to tell you, I'm a pancreatic cancer survivor. I've survived pancreatic cancer for 8 years. One of the things I think that has kept me alive is understanding that when you let things go, you live longer. And that's important for me, It's important for me. Plus, it's just so much damn fun, man. I didn't like you at all when I didn't meet you. You were like a gnat in the room. And I was like, who is this man? You know, so let me find him so I can swat him.
Mm-hmm.
And that's how we live. But if we can just put that stuff on the shelf long enough, we'll understand that the reason I want to swat you is because you got something I need, you know? And we don't think of each other as having stuff that will keep us alive.
Yeah.
We don't see each other as partners in possibilities. You are someone who I can partner with to become my best self. I am someone you can partner with to become more your best self. You know, the enemy will tell us, you know, get your own, take care of yourself. But what they don't tell us is that truth makes you stronger. And the truth of it is that we are connected one to the other.
Absolutely.
You know, and if you don't make it, I don't make it. You know, and that's that we need to stop telling that lie.
Yeah.
And get with it. We need to figure out how can we keep this strong.
Yeah.
How can I empower your possibilities so that my possibilities can? Because the stronger you get, the sooner I can retire.
Okay. Yes, ma'am.
I got stuff. I
Said you got stuff to do. Okay.
You know, but I need for you to do the running. I
Yes,
need for you to
ma'am.
do the leg work.
Well, I'm ready to run.
There you go.
But I want to kind of go to a call because you already preaching already. I want you to look in this camera, and what we do, we call it the call, right? I want you to look in this camera and give community a minute for a call to action of work that we need to work on, of ways that we can get connected with you.
Well, you can get connected. I am HIV manager at African American Reach and Teach Health, which is ART. You can connect with me is at Renee M at aarth.org, and send me an email. Connect. There's so much we can do. We got a program now that's going to provide support for seniors, focused on Black seniors. And we certainly want to get Black senior LGBTQ people involved in it. The call to action is primarily, don't think for one that you deserve to be alive. And if you deserve to be alive, then what do you need? So call me up, call Deaunte, call somebody and say, help me stay alive. And the other is, I think the greatest call to action that we have is to maintain hope. Hope is a superpower. Hope is our greatest act of resistance. When we stop hoping, we fail. But to see hope as an act of resistance in a world that tells you there is no hope for you. And LGBTQ people have been told all our life there is no hope for us. So hope is an act of resistance. It's the truth, and live that truth. Is that a good enough call?
Girl, that was good.
All right.
Well, we do got to get out of here, but I just want to thank you, Reverend Doctor.
Oh,
I know we come a long way, but what I really realize is how effective we are when we do work together.
We's a bad
team.
We's a
Okay,
bad
give me a high five, girl. You can't leave me hanging.
We's a bad team.
But I appreciate you coming in, and just wait. If they see what we did this year, wait till they see what we got coming in the summer.
Yeah.
And I love you, and thank you for
you too.
creating space for all community members, and also reminding us that we're in this together. And I want to thank you, community. We are in this together, and join us together next Thursday for another episode of We Live in Color. Remember to walk with love.